day, everyone. My name is Dr. Rambau. I am from Mami Bear, Mother and Child Clinic, and I'm also a general practitioner at Dr. Mashudu and Medical Partners. I am here today to teach you about something we call ectopic pregnancy. So let's dive into what is this ectopic pregnancy. So ectopic pregnancy is when a pregnancy decides to implant anywhere else other than the endometrial lining. This pregnancy can implant in the tubes, it can implant in the ampullary, it can implant in the intestines, it can implant in the abdomen, in the cervix, and other places that are not the endometrial lining. So what are the risk factors of getting an ectopic pregnancy? Women who have had previous operations, especially tube operations. This can be women who have done tubal ligation or sterilization. So if it happens that they fall pregnant, already the tube is damaged, so the pregnancy may stick to that damage or to that scar that is already there. This can be smokers, because people who are smoking, the endometrial lining becomes damaged from all the smoking that is happening. So the pregnancy end up implanting in the wrong place because it can't be pushed forward to where it's supposed to go and implant. This can also occur in women who have gone through infertility. It can happen in women who have had previously genital infection. It could be STIs, women who have also had previous miscarriages, women who are older than 40 years, as well as women who have went through previous termination of pregnancy. So these are some of the risk factors that make one susceptible to getting ectopic pregnancy. So what are the protective factors? Because if there is risk, it means there is also something we can do to protect ourselves. So contraceptives, yes, you heard me right. If you are taking contraceptives, you decrease your risk of getting ectopic pregnancy. How would you know that I am pregnant, but this pregnancy is not the normal pregnancy? You will have signs of amenorrhea. Amenorrhea, it's when you don't see your periods. Secondly, you will have PV bleeding. You are not seeing your periods, but you've got this bleeding that is coming, which is abnormal as compared to your normal periods. And also lastly, you will have abdominal pain. This pain can be localized, it can be sharp, stabbing pain that is so uncomfortable for you. So once you see those signs, run to the doctor. The doctor or your midwife, they are going to do, number one, a pregnancy test. A pregnancy test will come out positive to indicate that indeed you are pregnant. But here is what they are going to find. When they do an ultrasound or a sonar, they are going to find that your uterus is completely empty. Or if it's not empty, there could be some fluid, but they can't find the gestational sac or a baby inside the uterus. And the other thing that they are going to find is that there will be some fluid in what we call the pouch of Douglas. So there's not supposed to be any fluid unless if there are complications of pregnancy. The other thing that is going to happen is that when you do your BCG levels, they will also be normal, indicating that the mommy is pregnant. So as soon as they pick that up, they need to decide on the method of treatment. They can treat you by surgical method, or they can treat you by medical methods. Medical include a treatment which is called methotrexate, which is a pill which you are given by your medical practitioners, and then when you've been given that pill, you must take it, and the levels of beta HCG must be monitored to make sure that they are going down. If they are not going down, it means the method is not working, and therefore we must go take you through to theater and remove the ectopic pregnancy. The second method, as I said, it's by operation. Operation can be done laparoscopical or laparotomy, whereby they can either open up or they just go in through some cameras that can help them operate you without completely opening your tummy. So this operation, they are going to visualize the inside and look where exactly has this baby implanted or this pregnancy implanted, and they are going to cut it and remove it completely. Okay, so there is nothing, as I said, that cannot be managed. If you happen to have developed an ectopic pregnancy, it doesn't mean you won't be able to have other children. Some ectopic pregnancy, we might have to completely remove one tube because it has implanted there, but it will still leave you with a second one that you can try and hopefully get another one. Okay, so mommies, as soon as you get these signs, don't stay at home, rush and go see your medical professionals. Thank you and all the best.